October 29 is World Stroke Day. The global lifetime risk of stroke is 1 in 4. Stroke is a neurological emergency and can lead to severe disability and even death. But with the recent advances in treatment of stroke, like thrombolysis, that is dissolving the clot with medication, and thrombectomy, mechanical removal of the clot, it is possible to reverse the symptoms of stroke, limit the disability, and improve the quality of life. But these CCAT procedures are time dependent and one needs to seek medical treatment at the earliest. In LISI Hospital, we have the expertise and infrastructure for these procedures.
First step in management of stroke is recognizing that the patient has stroke. So patient should be aware that the patient has developed stroke. So the common symptoms associated with stroke are facial deviation, that is face deviating to one side, arm involvement like weakness of the arm, and any change in the way the patient speaks. So there is a mnemonic to describe these symptoms, which is called FAST, that is F-A-S-T, that is face drooping, arm weakness, speech difficulty, and T is time to call. Along with that, you can have associated leg weakness also.
At 8:30 a.m., the triage nurse of LISI Emergency Department receives a phone call from an ambulance service regarding a stroke case approaching our hospital. As soon as the patient arrives in the ambulance to our emergency bay, the triage nurse approaches the ambulance and collects a quick history from the patient's bystander. And upon knowing that the patient is in window period, shifts the patient to priority 1 of emergency department. On shifting the patient to priority 1 of the emergency department, the triage nurse gives handing over to the staff nurse of the priority 1. The patient is then connected to pulse oximetry and BP cuff is tied around his arm. Patient's vitals such as blood pressure, heart rate, saturation, and random blood sugar is noted. The patient is then cannulated and blood is drawn for necessary investigation. The emergency physician then takes a quick history from the patient's bystander and does a quick initial assessment. Meanwhile, the staff nurse is asked to alert the stroke team. Staff nurse also alerts the CT console. The CT room is then prepared for receiving the patient.
The neurologist on call sees the patient, takes a detailed history regarding the time of onset of stroke symptoms, and assesses for the severity of stroke based on the NIHS stroke scale. He then decides if the patient is a potential candidate for IV thrombolysis or clot dissolving injections. If at all the patient has come within 4.5 hours of onset of stroke symptoms. A CT brain is then taken urgently, ideally within 25 minutes of arrival in the casualty, and reviewed by the radiologist, who looks for signs of bleeding or brain hemorrhage, which is an absolute contraindication. That is an absolute no for clot dissolving injections. Other signs to be looked for in a CT scan are the severity of stroke based on the aspect score and signs of large vessel occlusion based on vessel imaging. After this, a consent is obtained from the bystander after he is explained that the patient has suffered from a stroke or brain attack similar to heart attack, in which a blood vessel supplying the portion of the brain is blocked by a clot and needs to be dissolved using clot dissolving injections.
We give the clot busting medication, which is the thrombolytic. We have two varieties in the Indian markets. The price may range from 25,000 to 60,000, and depending upon your current scenario about the patient's condition, the physician will decide which particular drug will be more safe for you. And there are certain indications and certain contraindications before giving this medicine. For example, if you have had a recent intracranial bleed for the past at any point in your life, or if you have had a recent stroke during the past 3 months, or if you have had if you are on certain medications like warfarin or some anticoagulants, then the doctor might actually consider the other not giving the medicine to be safer under such circumstances.
In case the person comes with a large vessel occlusion that is detected on CT or MRI scan, these patients are taken up for angiogram. If the patient has come within 4.5 hours, we take the patient after thrombolysis, and after 6 hours, these patients are directly taken for angiogram. And any of the clots that we see, we can remove. There are multiple techniques available. We can either use aspiration or we can use stent reverse. Multiple techniques are there, and more than 90% cases we can remove the clots. And once we remove the clots, the outcome is drastically different. Many of the patients go back to their normal life. In other patients that have reached the hospital a bit late, the recovery is much faster, and with physiotherapy, they can get back to their normal lives much earlier.
So we urge general public to recognize the symptoms of stroke early and to reach nearby hospital having facility for medical, interventional and neuro rehabilitation programs running dedicatedly for treatment of acute stroke patients.
Time is brain. Be fast in recognizing symptoms of stroke. Seek medical attention at earliest to save the speech, mobility and independence of living.